Hello and welcome to another engaging session of our roundtable at HubMedet. If you don't know me, I am Dr. Juan Sopena, dermatologist from Spain with more than 20 years of experience in aesthetics. And before I introduce you the topic for today, I would like our panel of experts to introduce themselves for the new followers.
Hi, my name is Dr. Martina Blaho. I'm a neurologist from Austria, Vienna. I'm doing neurotoxin for many years for medical indications, and I'm now switched to also aesthetic indications and to expand the field of my treatments.
Wonderful. Our plastic surgeon, Dr. Cohen.
Yeah, well, my name is Sarit Cohen and I'm a board-certified plastic surgeon. I'm doing aesthetic surgical and non-surgical procedures.
Very good. Our scientific dermatologist, Dr. Selina.
Hi everyone, thank you for having me here. My name is Dr. Evgenia Shelemba. I'm based in Kiev, Ukraine. I'm a dermatologist and I work in this field since 2012. I'm happy to be here and to share my knowledge and experience with all of you.
Hello everyone, my name is Dr. Dean Berman and I'm an aesthetic doctor. I've been doing it for several of years without revealing my age. I'm very, very happy to be here and looking forward to hear what my peers have to say about the really interesting topic that we've got today.
Maya.
Thank you so much for having me. My name is Dr. Maya Sinai. I'm an aesthetic dermatologist and Mohs surgeon. I've been working in dermatology since 2004, and I'm really, really happy to be here and learn from all of you today.
Hi everybody, thank you for having me here. My name is Dr. Izabela Kobylińska. I am board-certified dermatologist from Poland, based in Gdańsk, running my own clinic. I am very happy to share my knowledge and my experience with you, dear colleagues.
Thank you, all of you. You are all here because the incredible level of expertise that you all have. Today's topic is a little bit controversial. We want to explore the art of beautification in aesthetic medicine, as opposed to these trends like the Barbie look trend or the overtreated, results and looking. So, from as healthcare professionals, how do we integrate these aesthetic trends and maintain at the same time our integrity, regarding this, these issues?
For me, it is always like a red light when I see a patient who comes to my office and asking about such a, look, like Barbie look or different trend from internet. I am always spending more time with this patient. This is always about medical education for doctors, but also patient education. I try to understand the needs. It might be the, BDS, body disorder syndrome, for example. It might be the, other problems at patient's life. So we really need to understand this person and the question that she came to ask for this kind of treatments.
Yeah, I think it's really important that when you're not just treating patients, as important as that is which patients not to treat. First things you do, along with the medical history like we spoke about before, is really understanding the patient's motivation for coming in. If there's not this expectation that is realistic, I recommend not even starting any kind of treatment with someone like that, because you won't be able to release them from these pre-existing notions, things that are not realistic. And I think that the Barbie look, because it's this computer-generated look, will never be something that you can attain in your clinic. And so having the skills and the tools to see those patients, sometimes you can see them from the door when they walk in, and sometimes these unrealistic expectations only happen during the conversation, when you start talking about what kind of things they're interested in and what you can do for them, you realize that you're not speaking the same language. And you really need to be very sensitive to when you feel that way, to pick up on it and say, this is a patient that doesn't match my clinic, that I cannot help, that is something that you just won't be able to get out of, and you will spare yourself lots of stress and lots of telephone calls and lots of consultations if you're able to be realistic with them and with yourself when you see them in the clinic.
Right. Dean, any comments you want to add?
I think that what is crucial for us to remember is safety. At the end of the day, we are doctors that need to help our patients. And yes, we help our patients to reach a certain look that they might desire, but we have to draw the red line somewhere.
You just got to the next point that I wanted to add, but I want to share first a little anecdote that I thought it was funny because, how do I confront this, request from patients when we know that the kind of treatment that they're requesting will not look natural? So I actually use this trend into a positive way. And I'm going to put an example. I have a clinic where I work, part-time in Dubai, and I remember 10, 12 years ago, there was a trend in the Texas treatment, and all the females were asking for this Texas treatment. But what I really wanted to do is actually some of those patients needed support rather than a treatment in the jawline and the neck. What they really wanted or they needed was support in the midface. So what I said is create a little bit of a strategy and tell them, but do you want the Texas treatment or the new Spanish Texas? Yeah. Which is, as soon as you say the new Spanish Texas, so I took profit of these bad trends and turn it into, what's this new Spanish Texas? So it's the same treatment that you are requesting, but we start from here. And obviously, because it was new, they actually loved it, and it was really helpful. But yes, as you said, how do we, merge together the need or the request for these treatments, maintaining their well-being? What is your strategy?
Just to be very honest with the patient, and usually they are very young. Usually if somebody comes to ask for Barbie look, she's very young and she's probably getting those trends from TikTok or Instagram. And we are doctors. We need to spend time with this patient. We need to talk to them. We need to make them to understand, our treatments, our job.
Also, we need to think sometimes about long-term results, about this, these trends. What do you think, Dr. Cohen, about those?
I think that it is a very important point to look at the patient motivation. So most of our patients today desire a natural, age-appropriate look. They want to remain themselves, not to change their facial expression, simply to achieve more freshness, harmony, and youth, and to get rid of features that look tired, pessimistic, pouty, or grumpy. So it is only these subtle enhancements, and these subtle enhancements make large differences for the perceived facial information.
Right, Maya, any thoughts about this you want to add?
I absolutely agree. I think it's an excellent point. I still think that when you're realistic with yourself and with your patient, you come together and you really make that journey together, because you know what you can and can't do, especially in the beginning. You start learning new techniques and you start learning new devices, and you're able to do things with them. But if they're starting to kind of run off the side and want other things, you really need to be very honest with them. It's going to save you lots of headache in the future. I know that, like for instance, in my surgical dermatology clinics, a lot of patients will come in and want a removal of a mole or something like that, and they say, well, I don't want a scar. But that is impossible. And no matter what we do to the skin, that will leave some kind of mark. And so you have to, even though you want to tell them that there won't be a scar and it'll be beautiful, you have to be honest with them and give them the a decision to make, and don't make the decision for them. So I agree. I think that that's really important.
Yeah, I agree totally. So with the significant influence of these platforms like TikTok, and especially concerning about this like Barbie trend look, or how should we address this trend? How should we manage, or reduce the credibility, or I don't know, sometimes it could be a good trend, but in most of the cases, we're talking about treatments that end with an overtreated look. So how do we address this with all the influence of this social media?
In my opinion, there shouldn't be any trends. There is no trends. We should personalize our treatments with every patient. So I don't agree that we have trends or we have to follow any trends. So yeah, for me it's like always about being honest. You have a plan for the patient. If the patient doesn't agree, just don't touch it. Don't touch him.
Aesthetic ideal and standards of beauty change from century to century, decade to decade, and even generation to generation. So our role, I think, is to find the way between the general accepted and the individual beauty. And certainly we have values for facial sizes, proportion, angles that enable us to formulate common rule for the aesthetic ideal. So we are both healthcare givers, healthcare practitioners, and artists as well. And we should find our way in between.
I think that's a fantastic point, because not only the trends or the criteria of beauty changes with time, but also in different regions. Could be something that we like in the Caucasian species, but you don't like it in an Asian patient. This happened to me in an event like in Asia, in Korea, when I trained, and I did one of these filler treatments and got a fantastic V shape, and the patient looked at herself and was horrified, because what they want is a round face. So I think what we need to do in the future is also to create the good trends, and I think in the future I stimulate you to create and show us in HubMedEd, the trends that are the good trends.
I think this is exactly what we're doing, because doctors in general, also when we look at the history of medicine, doctors were always the people of science, the people of innovations, those that brought something new because we wanted to make a difference, to make an improvement. And when we look, let's take lips as an example. When you look at the evolutions of lips over the years, what the request for lips were in regards to the requests of lips today, the genders, the age, the proportions, we can see a big shift. Now, it is our role, our job as doctors to draw a certain line and to say not just whether it's natural or unnatural, but also to give the consultation. This is our responsibility, to give the consultations based on our experience, whether those lips will fit the rest of the features, the structures of the face. Exactly.
Sometimes it is enough to show the patient proportions, her proportions, and symmetry, because she came with a picture of a celebrity, or she wants the Barbie look. And then if you discuss her proportions with the patient, then she agrees. Then afterwards she doesn't want anymore this look, because she understands right now her features, her proportions, her symmetry.
Isabella, it's so true. It brings us back to, in my opinion, the most important point: education. Yes. Okay, it all begins and ends with education. When we educate our patients, when we educate ourselves, when we educate our colleagues, and this is exactly what this platform is trying to achieve: a proper, unbiased education that will give eventually the best results and the best educations for all of us.
I agree with both of you. And I would add one key point as well, which to me is getting a natural result, in my opinion, depends on treating the cause of aging and not the consequence of aging. Rather than trying to look for a final result, what we have to do, and this is what we're going to try to help you at HubMedEd with the different sections and treatments, is actually to identify what is the cause of the aging sign and treat the cause rather than the consequence, because that's going to be crucial to get a natural result. Don't you agree with this?
Yes. I agree, and you have raised so many meaningful topics, such as trends, such as generations, as Dr. Sarit said. such as education of patients, because we must guide patients to understand that these trends are often fleeting and may not necessarily align with the natural aesthetics and look of the patient. Because when I think about the Barbie trend, I think that since Barbie was created in 1959, the look of the doll has changed during the decades, but it always looked up to date in the decade when it was created. In 60s it had different look, in 70s.
Also, how many Barbies do we have now? How many different Barbies do we have? Not only one look. You have so many different Barbie dolls, you know?
Yes, different age, different skin color, even different professions. So I think that a Barbie look is not looking like everyone else, looking same. It is about leaving the natural features of the face and just enhancing them, but keeping the personality of the patient. And it comes from the education.
Very good point, Dr. Slemba. But for us might be easy, but from a neurologic point of view, Martina, how do you deal with these trends? Because you're using, medications, what are considered, injectables or medications.
Actually, the Barbie look, of course, it can be captivating, but it's very important to approach them with a perspective, as you already said, that values individuality. For example, I always advise my patients to consider how those trends align with their natural features and, of course, their long aesthetic goals. So, for example, like the movie just came up, the Barbie movie, I had many patients coming to my office and ask me, I want to get the trap dogs. It's very new, trap dogs. And I told them, no, trap dog is not new. I'm using this with medical indication for many years to relax the trapezius when they have too much tension and headaches or cervical syndrome or something like this. And I asked the patient, why do you want to have it? And they always answer, I want to have a slimmer neck. So it's like you say, Dean, it's about educating the patients on what they want and what they need.
I actually agree, and I also advise my parents, because my mother has always been my first patient when I treated, and when I used the product for the first time, my mother was always my first patient. So, any additional comment?
And also the diversity, as you said, because in the different country, patients seek different look and a different approach. So we should take that into the consideration, of course, the ethnical background, and we should be familiar with the treatments that differ from one region to another region, from one skin type to another skin phototype. And this is what we want to share in the platform, because we come from different parts of the world and we have experience working like in Middle East, in other countries like more Western countries. That's the benefit of the platform, that we have combined everything here to share with colleagues from all over the world, and we also want the experience from the colleagues who will join us.
And also, and maybe let's say it clear that tell to the patient no is also a help.
Definitely, I think.
Can I just tell a very nice story with Dean? I asked you this question, you remember, and you said to me, okay, Tina, there's one answer. You tell the patient, you are so lucky you met me, because there are many other doctors outside, they would treat you right away. And I'm the one who is telling you, we're not doing this, because I explained to you why we're not doing this. And I think of this story you told me, and I'm using it quite often.
I think that no answer is very important, especially for the beginners or the doctors that are starting in this field, because you might lose that treatment or that patient because you are not providing what they really wanted or they demanded, but they will come back. In my experience, after 24 years, those patients will come back to you and they will value your no as a first answer. And they will know that you are ethical and a good professional, and then it's how you grow. I think that is very important. So in closing, what message do we hope to impart about beautification in medical aesthetics?
I think that if we'll conclude everything that we heard here, first of all, as Tina said, no is a powerful word, and it is our responsibility. It is part of the reason why we're doing medicine is to help our patients, but also to prevent them from doing something that they might regret afterwards. We need to to put all the cards on the table, to explain to them the why and the how, to explain to them why our answer might be no or why our answer might be yes, okay? And only when the whole information is out there to let them do the decision. The decision could be, I'm leaving this office because he said no. The decision might be, I agree with them, okay? I will do whatever they recommend me, okay? But, and this will be my advice to new doctors, you need to feel very comfortable with whatever you're doing. If a patient makes you feel uncomfortable or doubt what you're doing, then don't do it. Give yourself this red flag as a sign to take a step back and only do things that you know that you are doing well, that you are comfortable. And if there's something that you are lacking, then join a platform like this, learn, ask questions.
It's always an opportunity to actually show that patient that there is another option that is going to be better for them and demonstrate your knowledge and your value in facial aesthetics. Maya, you want to add something?
Yeah, I think that when we speak about the aesthetic treatments that we do and we're talking about beautification, there's a very clear difference between transforming them and enhancing what they have. And you always have to, I think, err on the side of just enhancement and maintaining and keeping them with their good skin quality and their keeping them looking young and natural and not changing their natural anatomy. So it's really important that I like to know that when I've done a treatment on someone and someone says something to them, I take that as maybe I did too much. Maybe next time we need to take a step back, and I let their responses and the way they deal with each treatment kind of guide me along as I go, so that the next treatment won't be too much or too little, that I kind of dose it as we go. So it's really important. The continuity of care is also very important.
I think this is an excellent conclusion for our roundtable today. I want to thank you all for being here again with us and sharing your expertise. And until we meet again, this is MedMinds Roundtable at HubMedEd, which is the independent platform from doctors to doctors. Join our community. Thank you.